Being able-bodied, walking, running, performing simple or tough chores may seem so normal, but for some people, this may be hard and painful. My name is Dr. Mercy Korir, and on this episode of Health Digest, we focus on osteogenesis imperfecta, better known as brittle bone disease. On this episode, as prepared by our health and science reporter Matilda Mbenywe, Alex Kiarie and Michael Mute, we focus on the story of a young boy in Kisumu County who lives with osteogenesis imperfecta. Sneezing in itself may cause his bones to break. It is a new day for 80-year-old George Otieno Onyango, who lives with his mother in Mamboleo village, Kisumu County. Another day of pain that has now become a new normal as he recovers from yet another fracture. His small frame betrays his true age, thanks to a life that is marked by countless visits to hospitals and admissions. According to his mother Diana Akumu, his bones never seem to stop breaking.
George naye ameshavunjika kwa mapaja, ameshavunjika mara 5. Kwa mguu hapa karibu na magoti alishavunjika mara 3. Ukilekea huku chini ameshavunjika mara 4. Huku kwa mkono ameshavunjika mara 5. Hata siwezi hesabu. Huku pia ameshavunjika to the same. Huku pia alivunjika juzi, huku kwa mguu alivunjika juzi ya mwisho yenye bado hajavunjika mpaka sasa.
As Diana looks back at the journey and life of her son, she recalls the moment she realized that her son was born different after a freak accident.
Ulemavu yake ilianza, nilimpatia mtoto mwingine akamwangusha. Venye alimwangusha, hapo mwanzo ndio hiyo ulemavu yake ilianza. Nikambeba nikampeleka Kenyatta. Watu wa Kenyatta wakamwekea plaster. Akakaa nayo na hiyo plaster for 3 months. After 3 months wakamtolea hiyo plaster. So hiyo ndio condition yenye ako nayo. Hawezi maliza hata miezi 2 kama hajavunjika.
While Diana walks the footsteps of her son as a parent, she's still in the dark as far as her son's predicament is concerned. But this is clearly a case of a breakdown in communication.
Venye nilimpeleka hospitali, the first day walimwekea tu plaster. Hakuna kenye waliniambia. The second day pia hakuna kenye wameshaniambia kuhusu ugonjwa yake. Hakuna kenye wameshanieleza. Test nao wanafanya na kuna results wameshanipea. Wanaandika tu lakini hawajaniambia ati hii ndio ugonjwa yenye nafanya huyu mtoto. Sasa kwangu sijui ugonjwa yake.
According to experts at the Jaramogi Oginga Odinga Hospital in Kisumu, George is suffering from a rare condition called osteogenesis imperfecta or brittle bone disease. The disease weakens one's bones, making them easily break, even under very minimal pressure in severe cases.
At the hospital, usually these patients are, they come to the hospital at different levels. They come at A&E, emergency department, with fractures. They can come in the maternity, that is at birth. It can be able to be detected immediately the child is born. Then the midwives are able to detect that this child has fracture at birth. You know, there are children who can be born with fractures. So that can be a presentation. Sometimes the child can be born with very weak bones, bow legs, and that can also raise our index of suspicion. Outpatient, they can also be seen outpatient, just as a patient comes with a mother, but the mother doesn't see the condition as a problem. But then when they are seen in the pediatric clinic or in the outpatient, then the doctor and the outpatient will then refer the patient for further management at our department of orthopedics. Usually, osteogenic imperfecta is classified into different types, and usually it is we have type 1 up to type 8, but the severe forms, the ones that we are interested in, the most common forms are usually type 1 to type 4.
According to Vincent Owa, who is a clinical officer specializing in orthopedics and trauma surgery, brittle bone disease is a genetic disease which occurs due to a lack of high-quality collagen, one of the proteins which forms the framework for the bones.
The condition is common in patients with family history of osteogenic imperfecta. Probably a child whose parent had the same condition, either the mother or the father or the grandfather for that matter.
The condition manifests in various degrees.
Usually this condition can present itself in mild, moderate and severe forms. And severe forms of osteogenic imperfecta can lead to early death at infancy or premature death in utero, that is when the child is still in the womb, or the child can die immediately after birth. Now, like in the setting where I work, I encounter such patients, though not so much, because it's a rare condition, but you'll be able to find these patients in working places like our Department of Orthopedics. We have these patients, we see, I would talk about in a month, we would see about 5 of them.
The brittle bone X-ray looks thin, it has got a glass appearance, they are deformed, and then they appear more osteoporotic, which means they are prone to fractures, and they lack that calcium. And after the diagnosis has been made, the patients are either referred back to the requesting doctor or to orthopedic surgeon for management.
Making a diagnosis of brittle bone disease comes in stages, depending on the severity of the condition.
Diagnosis is usually based on clinical assessment of the patient, radiological investigations, and laboratory investigations. Once you take the history, you can go ahead now and do radiological investigations, which involves taking x-rays for patient to assess the fractures, if the patient has fractures, and to assess the level of deformity of the bones. You can also do CT scans and MRIs. Then you can do laboratory investigations, which would involve studying of the structures of the collagen fibers, collagen of the body. You can also do punch biopsy for the skin to be able to analyze the condition. Then finally, you can also be able to do genetic assessment of the patient to find out which is the source of this condition to the patient.
According to there are several types of brittle bone disease, with some cases being more severe than others.
Type 2 and 3 are the most severe forms of osteogenic imperfecta. Patient usually presents with multiple fractures. Patient present with obvious bone deformities at birth. At times, these patients die before delivery or immediately after birth. Usually, it comes as a result of production of very poor quality or lack of collagen in the body. Now, type 4 is a mild form of osteogenic imperfecta, which is also common. Usually children are born with bow legs, which with time, the bonus goes down and patients are able to walk. Unlike type 2 and 3, where patients are usually wheelchair bound, they're not able to walk. In type 4, the patients are able to use their limbs, the bones with the time straighten, and patients are able to perform their day-to-day activities. The most significant thing about type 2 and 3 is that these patients are not able to perform their day-to-day activities. But for type 4, patient is able to go to school if it's a child, patient is able to bathe alone, patient is able to, apart from small deformities of the legs.
Since the disease cannot be cured, it can only be managed. This may involve surgery and prescription medicine that help in strengthening the bones. Occupational therapy also comes in handy.
As occupational therapy, we are not the only one to manage these kind of clients. They need a multidisciplinary management for them to be able to recover. So number one, it is important for these clients to receive occupational therapy because it ends up strengthening their muscles. It also prevents them from having fractures. It also prevents them from having deformities like scoliosis. It also prevents them from having long-term disability. So occupational therapy is important in those areas.
So what are the signs and symptoms of this disease?
Patient presents with obvious deformities of the upper and lower limbs. Patient presents with blue sclera, that is the white part of the eye. Patients, some of them are born with blue eyes. Patient presents with heart diseases. Patient presents with scoliosis. Scoliosis is a condition where there is the spinal bones, the vertebral bones, they bend towards the lateral side. Sometimes patients also present with kyphosis, where the bone is also deformed outwards. Sometimes these patients in severe cases have respiratory symptoms, that is difficulty in breathing as a result of weakness of the cage, the rib cage. They present with fractures of the rib or fractures or just weakness of the bones of the ribs. These patients sometimes may have involuntary fractures without cause. For example, a child was just walking and then, or just trying to raise the arm like this, and then he gets a fracture of the forearm or of the arm. And there's no force that has caused that kind of fracture. In other cases also, you find that very little force causes very severe fractures in these patients. For example, a child or a boy or a baby will be walking and he slides and falls, and if he slides, he gets a fracture of the femur, which is one of the biggest bones of the body. And that kind of force is not able to cause that kind of an injury. So those are some of the symptoms. Then we have growth retardation or shortness in stature. Some of them usually have very short stature because of the bones are not able to grow as fast as expected. So you may find that child who is even 25 years old, but if you look at the stature, it looks like his height is like for maybe 5-year or 10-year-old baby. And of course, microcephaly, where the patient has a very big head. The head is not proportionate to the body.
To caregivers like Diana, managing this condition comes at a great cost.
Saa zingine naumia kama tuna pesa, itabidi akae kwa nyumba, apone tu hapo kwa nyumba. Kama juu mtoto anaweza vunjika hata mara 3, hauna hiyo pesa ya kumpeleka. Juu kumtoa hapa itabidi umpeleke na private car, huwezi mpeleka na gari ya barabara. Saa zingine hatuna hiyo pesa. Sasa anaponea tu kwa nyumba, alafu anaendelea tu na maisha hivyo tu.
These patients, being that they require recurrent consultations, multidisciplinary, it becomes very difficult to manage. And so that is the biggest challenge that usually these mothers with such babies or parents to such children or even adults with such conditions face, because they have to continuously buy the drugs, they have to continuously go for physical therapy, they have to go for occupational therapy continuously, and they have to be reviewed by different specialists. And so that comes with a lot of cost implication. The good thing for Kisumu County, like Jaramogi where I work, is that the county government introduced something called universal health care. Then there was also a local insurance called Marwa. So this Marwa has been able to help patients to access some of these services free of charge, because without that it would be very expensive. Some of those patients are able to even access surgeries in Russia without paying a cent, because Marwa and the local insurance for the county government is able to cater for the cost. Outside Kisumu, it becomes very expensive. And that's why also we encourage members of the public to be able to have NHIF, because NHIF is able to cater for a good percentage of cost of some of these services, like rehabilitation services, physiotherapy, surgeries, most of consultations, some of them NHIF is able to cater for. So that is what we encourage members of the public to do.
This same condition does not only affect the physical part of a client, but it also affects the emotional part. It also affects even the social aspect of this client. So as occupational therapy, we do manage. If they are presenting with pain, we do manage pain management. If they are presenting with weakness of their muscles, we do manage the weakness of their muscles. And because the condition is not purely cured, we do recommend that they be managed by different departments, because they require multidisciplinary management, so that they can be able to reduce the chances of them having the pain, which would also reduce their emotional status, because if they're affected and they can decide to be isolated from the other clans, we could wish that we recommend they engage in groups so that their social status is improved.
In some severe cases like type 2 and type 3 of brittle bone disease, patients may require assistive aids like wheelchairs or braces to protect their bones from snapping due to unnecessary but preventable movements. However, occupational therapy plays an integral role in enabling those with less severe cases to engage in day-to-day activities just like everyone else, but they may be limited in their choices.
We do recommend that they engage in activities that do not spend much of their energy, like swimming activities, because if these children who have brittle bones, they engage in activities like the sports, like which end up twisting their hands, twisting their legs, like football, they may end up fracturing their legs. We also advise the teachers together with the caregivers on the racial activities that these children are also supposed to engage in.
For Diana, the stigma that her son faces in school leaves her in distress.
Life ya George na haijakuwa mzuri sana kwangu. Juu ukipata mtoto anatembea na matako chini hivi, ukimpeleka kwa shule watoto wenzake wachezi naye wanamwogopa. Juu sasa miaka yake ingekuwa sasa akata class 3 na sasa ndio ako class 1, watoto wampendi, walimu wampendi. Sasa hapo ndio challenges zenye niko nazo. Wanakuambia rudisha mtoto nyumbani, kila saa narudi nyumbani. Hii this time mtoto hajaenda shule, hajakanyaga juu hiyo ya ulemavu yake.
She's calling for her son to be granted an opportunity to scale heights while making his little steps.
Kenya George anahitaji sana kwa sahi, anahitaji usaidizi ili atembee kama watoto wake watoto wengine. Ya pili, kwa shule inafaa ende shule nye anafanana watu wengine, si akuwe peke yake. Kwa shule yako peke yake wanamsukuma kila saa anaumia kwa shule. Sasa Kenya anahitaji ni usaidizi ya shule, ndio ya muhimu sana.
While brittle bone disease is a rare occurrence, some regions in Kenya seem to be more affected than others. According to a 2016 report published in the East African Orthopedic Journal by orthopedic experts from Cure Kenya in Kijabe, Machakos County leads, followed by Kiambu, Embu, Nairobi, with Kitale and Trans Nzoia counties closing the top 5 list. Nakuru, Kisii, Meru, Mombasa and Uasin Gishu also posted high cases of brittle bone disease. While brittle bone disease cannot be cured, people living with it should not be judged by their condition. Instead, they should be enabled to realize their dreams in an affordable atmosphere. The disease may be their present, but this should not determine their future.